Hello, everyone. Good evening. Thank you so much for joining our webinar. We are about to start. We have a few more people joining. I see there are people joining us right now. Thank you all for watching. Welcome to our Wellness Wednesday webinar. Thank you everyone for logging in. This is a platform focused on health and wellness information, where we have guest speakers and specialists answering your questions about physical, emotional, and psychological health. My name is Zarmina, and I'm delighted to be on this journey with you today. This evening, we are discussing mental health and coping during COVID-19. Please join me in welcoming our guest speaker, Dr. Shuja Jafar-Ali, MD, Psychiatry. We have Dr. Shuja on the line with us. I would just like to introduce you to Dr. Shuja. Dr. Shuja Jafar, born in Pakistan and graduated from Aga Khan University, decided to become an adult psychiatrist due to interest in mental health. Dr. Shuja finished psychiatry residency from Harvard Medical School, where he won an award in excellence in medical student education. For over 20 years, he has been practicing at Kaiser Permanente in Northern California. He has seen a whole variety of psychiatric conditions and cases over the course of his career. He has a special interest in how childhood development affects our mental health, along with the impact of our habits and environment on mental health. Good morning, Dr. Shuja. Thank you for joining us today.
Good morning. Thank you so much, Zarmine, and thank you, Health Bank, for arranging this, and thank you, everybody, for being here this morning. I'm just so delighted to be here and talking about this topic. This disaster has hit everybody, and our parents got the infection 6 weeks ago or so. And I can tell you from my personal experience, my mind stopped working. When my siblings called me for questions, I couldn't think straight. I was sure I was going to lose my mom because she was more sickly. And it was just, we would not wish that on anybody, the fear of loss of a loved one. Yeah. It is, I'm sure that, everybody has their own stories and everybody has suffered and suffering, and there's like wealth of experience and right here in this crowd. So,
yes.
Yeah.
And you mentioned along with the wealth of experience, it's important to have the information, right, to handle the situations that we're facing.
Yeah. I think information is important. And actually, I've asked myself also, why is information important? Khalil Gibran had a very nice saying that the eyes do not see what the mind does not know. The way we look at things can completely change if we have information and knowledge versus if we don't. And that's one of the goals. We're hoping that maybe we can share some valuable information with you today that can help you take a different look at the whole thing.
Thank you. I'm certain there will be very valuable information, which brings me to our first question. What are the sequence of events that happen when a disaster like a pandemic occurs?
Yeah. So from a mental health point of view, when a disaster like this happens, it causes stress on human beings, right? And how does it cause stress? What kind of stress? Well, there are different kinds of stress. There are, we will get into that, but it causes stress. Stress leads to symptoms, right? So depression, anxiety, behavioral symptoms, and people don't like to suffer. So human beings have these natural defense mechanisms which are unconscious, and then they sometimes have conscious defense mechanisms or coping mechanisms. And so disaster, stress, suffering, and we don't want to suffer. So we have these coping mechanisms. Sometimes it's healthy and sometimes it's unhealthy. So I think that's the sequence of events. Lucky are the ones who have healthier coping mechanisms. They're likely to, have less suffering and get out of this without much mental suffering.
And can you tell us how has COVID-19 and this pandemic affected the mental health of people?
So, l- there are some very obvious ways in which it has affected people. Loss of life and health is the big one, or the fear of loss of life and health. Financial loss, economic crisis, and the fear of financial loss, right? People have lost jobs, people have had problems with socialization. So, for example, an old lady, widowed old lady who I know has been living in her apartment for the last 4 or 5 months without any activity. She used to have two main activities, going to the church and playing her bridge game once a week. And both of them have stopped. Um, you can imagine what she might be going through, right? Then loss of a job. It's horrible. But there's a man out there for whom that's the meaning in his life, being able to provide for his family. When he loses that job, he has lost meaning in this life. For almost everybody, the outlet, the ability to recreate, rewind ourselves after a tough day, a tough week of work has been affected for almost everybody. I'll give you my example. For me, the big outlet was playing table tennis. I'm an avid ping pong player, right? The ping pong clubs shut down. I felt so helpless. I didn't know what I was going to do. And I know I went through an adjustment disorder myself with that alone. And I was very, very fortunate that the tennis courts were open and it's more COVID-friendly sport. And I know how to play tennis and I was able to adapt myself playing tennis. I'm sure all of you have your own interesting stories, how you are having to adapt or successfully have adapted or struggling with what's going on right now.
And in addition to having outlets, you touched upon the lack or difficulty of socialization and the events we've had to miss in our lives, and how does that impact people and cause stressors leading to suffering?
Yeah, that's a great question. I mean, did you notice the mask alone is a stressor? Wearing the mask, or I mean, I'm walking on the beach and I'm far away from people, and I wasn't wearing a mask for a few minutes while I'm walking with my wife, and there are people over there, they're wearing masks, and they look at you like you have plague or something, and you feel so embarrassed, right? So not wearing mask is a problem. When you wear a mask, well, I like to see people smile. But I cannot. I have to look at the corner of their eyes to see, are they smiling in a grocery store? Are they upset with me? And my colleague says, he likes to look at a pretty face once in a while. And you can't. I was talking to my mom yesterday. She said, I can't wear my lipstick anymore. I mean, so, mask alone is an example of stressor. And you go to a restaurant to buy something. I went to buy a burger from a restaurant last night. And the first thing she did was she screamed, "You're not supposed to come in here and touch this bag yourself." And I'm so embarrassed. What did I do wrong? You don't have any signs there. And I'm like, come on, have some compassion for them. They're doing their job. So everybody's life is disrupted. Going to a funeral, you can't even do normal, natural things. You lose a loved one, or you're trying to give support or sympathy to someone, you cannot hug a person. Going to a funeral is not possible. Weddings, same thing. So everything is just, upside down these days.
Yes, absolutely. And I think that brings us to the fundamental question of what are the different types of healthy or unhealthy coping mechanisms at this difficult time?
Yeah. Yeah. I was thinking the same thing. The biggest thing that comes to my mind when we talk about it is the serenity prayer. I'm sorry if you guys have heard it many, many times, but that serenity prayer really applies in today's world more than any other time. So God grant me the serenity to accept the things that I cannot change, the courage to change the things I can, and the wisdom to know the difference. There are some countries that have been able to work on these principles and done really well, and some individuals too. And then there are some big countries that have failed to accept, for example, and have suffered and are still suffering. So yeah, that's
right.
one.
And,
Huh?
and tell us a little bit about the unhealthy approaches that we might fall victim to at some point or the other.
Yeah.
The unhealthy approaches to coping, such as denial.
Yeah. Denial. I'm glad you brought that up. I think, so we were talking about, disaster, stress, suffering, and coping mechanisms. So denial is an unconscious coping mechanism or defense mechanism that a lot of us have, and it can kick in. And so denial about the suffering, denial about some painful facts. Well, let me share a story with you. Long time ago, when I was doing my training, the chief professor of the Department of Outpatient Therapy shared a story with us that one of his patients, a young man in his late 20s, comes to him for an evaluation of his issues. And every question the doctor asks the patient, his answer was, "Oh, I have no problem. So how was your childhood? Great, no problem. How was your relationship with your parents? Very good, no problem. School, great. Work, great. Relationship with spouse, great." Well, and then at the end, the patient asks the doctor, "So doctor, how long do I have to be in treatment for?" And the doctor says, "Look, normally it would be only 6 months of therapy. But in your case, it's going to take me 2 years, because it will take me 1.5 years just to convince you that there is a problem, that there were some problems. And that's why you're here. And then the other 6 months to then work on those problems." So, but I'm glad for him that he was actually getting help though. Denial actually can keep people from getting help. And that's a big problem, because once you don't get help, once you are in a denial, it keeps you from doing anything about the problem. And that's a sure shot sign, path to disaster, right? And once you don't get help, you can imagine how easily it can have ripple effects. Your own health, your spouse, your relationship with your spouse, your family, your kids, your work, your kids' future. So, it becomes such an important thing, an unhealthy coping mechanism. Yeah.
That's great. And you touched upon the serenity prayer, and you've also referenced at times this pie chart of happiness. Can you touch upon how to take certain actions in your life, how much is in your hands, can do?
Yes. So yeah, that would be an example of, healthier coping mechanisms. And there are some healthy defense mechanisms that we know about. One of them is actually laughter or humor. It's considered very healthy, helping others. And we know now healthy chemicals and endorphins are released when you help others, when you have compassion for others, when you love somebody, when you hug somebody. But this particular study, from which we derived a pie chart of happiness. So pie chart is, like a pizza, and you divide it in different slices to describe the percentage. So what happened was, in this study, the happiness level was studied of some very rich places in Europe and United States, compared to the happiness level of human beings living literally in the slums in India, for example. And the surprising thing was that even though people living in the slums didn't have some basic resources, food, water, shelter, clothing, but they were much happier. And again, the reason for that was because they had the socialization. The parents would have chai or tea every afternoon together with their neighbors. The kids would play. Singing and dancing between kids and adults is extremely common. They had the social support network with each other, and that is a huge part. So in that pie chart, 50%, so a big slice, half of the pizza is genetics. 50% of our happiness is determined by genetics. We have no control. Nobody has control over it. It's in your blood. You cannot change that, right? But the other 50% is divided into 10% is life circumstances. You can call it luck, right? Somebody wins a lottery, right? The 40% that's left is intentional activities. And I should say that in this study, people living in the slums, they championed themselves in those intentional activities because they chose things that were therapeutic, that are therapeutic. And that's what determined their happiness. And I think that's what led to the result that the happiness level there was much better than the much richer population in Europe and US.
Wonderful. So would you say that on the flip side to denial, the healthy approach, coping mechanism is to have the courage to accept that there might be a problem, the courage to ask for help?
Yeah. I'm so glad you brought it up. You remember that serenity prayer, right? The first part was accept the things that I cannot change, right? By the way, I wanted to mention that in the acceptance thing, I forgot to mention that. Yesterday I was walking and I was talking to my mom because, the shortest distance between a human being and the truth is a story. So I wanted to ask my mom, what was her story? How did she deal with that when she had the virus? And she said, I left everything to my God. She's very religious. So that was her way of accepting it, that I cannot change it. So let me just leave it to the divine, the most divine, what can be more divine than God? And it worked for her really well. So your question was, the healthy coping, your question was, please repeat your question, was courage. Yes.
Courage, yes.
Yeah. So the courage to change the things I can. In our culture, the biggest thing where we need courage is to deal with the stigma of mental health, right? So denial is the big interference, and then to have the courage to get help. I think that would be the biggest thing where courage is needed especially in our. It's true in every culture, actually. I see a lot of difficulty in getting help, even in United States, where I am in California, but especially true in Southeast Asian culture. To get help, especially for mental. I mean, getting help for diabetes, blood pressure, heart, no problem. But getting help for mental health there's a huge stigma about it. You all know, I'm sure you all have experienced that.
Absolutely. Thank you so much for that. And Dr. Shuja, you shared a wonderful story with me about your neurologist colleague just before the call. And I would love if you could share it again for our viewers right now.
Yes. So, I've been working at Kaiser for over 20 years. And one day, one of my favorite, gurus, senior neurologist that I really look up to, he gave a talk on happiness. And I'm like, whoa, I want to attend that. I want to see what neurologists think about happiness. And he shared a story from his life that 25 years ago, I don't know, some of you who have been to the Bay Area, there is a very long bridge called San Mateo Bridge, which connects one part of the Bay Area with the other part. And he used to drive from this end of the bridge to that end of the bridge to come to work. And that's like a 10-mile bridge, one of the longest bridges. And back in the day, 25 years ago, the bridge was only like 1 lane or 2 lane. And there was an accident on the bridge and he was stuck. And in those days, I think they didn't even have cell phones, was not that common. So his pager is going off because he's late to work. He's getting paged again and again, and he can't even answer because he doesn't have a cell phone. He's frustrated, he's angry. It's 2 hours, he's stuck on the bridge. He finally gets to work. He goes to work, and he sees the cleaning lady over there, Giselle. He knows also is coming from that end of the bridge. And she looks really happy, and she's vacuuming the carpet, and he goes to her, Giselle, were you stuck on the bridge? She says, yes, doctor. Like, Giselle, you look really happy. I'm having the worst day of my life. And why are you so happy? It's like, yeah, doctor, I'm happy because I'm not the one who was in the accident. That's what I was thinking. And that was an aha moment for this neurologist. He said he learned a lesson of his life from Giselle, and he shared it with us. And he said, I call it the positive power of negative thinking. There's always something positive if you look at what's the worst that could have happened. And he was also sharing with me that in their home, prayers, when they did prayers at night, when they were kids, every night they would go over, God, thank you that I can eat. Thank you that I can digest my food. Thank you that I don't have toothache. Thank you that I'm able to, like those basic things that we take for granted. And there's wisdom in it. Yeah.
Absolutely. Yeah, I love that. The positive power of negative thinking. I think that should be our next segment. But that's great. Thank you, Dr. Shuja. We actually have some questions that have come in for you. I would like to share one of them. It said, in your bio, you have a special interest in the impact of childhood experiences later on in life. What is the impact this pandemic would have on children today and in the long run?
Right. So, I read a saying from Mahatma Gandhi recently that if you want true peace in this world, start with children. And I think it's so applicable. When I have a patient who's suffering and comes and sits in front of me, one of the first things I ask him, and after 20 plus years of doing this, I can tell you, I can almost guarantee that something has happened in the childhood, traumatic, physically or emotionally. And the environment in the home has a huge impact on the psychological development of the child. That triangle that the child forms with his mom and the mom and dad together, I think that triangle is crucial. If the triangle is stable and healthy, it helps in having healthy psychological development. And if the triangle or the home environment is disrupted, you can imagine lots of psychological issues can start in childhood and that linger on later on in life. And you see that in practical life every day.
Okay, great.
So,
Thank you.
so along the same lines, choices we make. Two families, same situation, may behave very differently. We have extra time right now in the house, right? So using that time, bonding with each other, starting healthy hobbies together, right? Singing together, laughing together, learning how to cook together, playing games together, learning a new skill together. I mean, that would be a healthier way to go about. And then, oh, he's still in the house, and you're not used to seeing your spouse, for example, in the house so much. He's always working and playing golf, and now he's telling me what I should do in the kitchen. So leave me alone. So, I mean, it's how we look at things and our own awareness about how we look at things, I would say.
That's so great that you just mentioned that. I mean, we're getting a few questions towards the impact of the pandemic and coping mechanisms on relationships. So, the relationships around us with our families and coworkers, and could you give us a little bit of information? People seem to be interested in to know more about that.
Yeah, the impact of this on relationships, or like I was just mentioning, right? They be aware of your feelings. There can be like a sense of uneasiness about seeing family members in the house all day long, and you're not comfortable about it. Accept it, right? Unfortunately, I'm sure the real numbers will come up later, but unfortunately, some of the unhealthy coping mechanisms has led to lots of problems in families, relationships, and domestic violence has gone up, drinking has gone up, marital problems has gone up. So yeah, a lot of negative things have happened. And sure, lucky are the ones who are able to adopt healthier coping mechanisms, adjust, have been flexible. The new norm, what we are doing right now is the new norm, right? And we have to be flexible. That brings us to that, another saying, it's not the big giant tree that's going to survive the storm. It's the little leaves of the grass that is willing to bend with the wind that's going to survive the storm. And we are in a storm right now. How flexible are we to adapting to newer ways? Right? And I think that's where, and people are so creative these days. I don't even know what kind of things people are able to do with the technology these days. People are watching movies together, plays together, cooking together, having meals together, shopping together, all on virtually. I'm not expert on that topic, but yeah, being able to be flexible and being creative and in those ways. Choices we make makes all the difference. And again, not being in denial and being aware, that will improve our chances of making healthier choices. Sorry, I went on a tangent. Go ahead.
We have some great questions coming in, so I'll select a few for you. So at this time, do you think coaching or counseling is necessary during these challenging and unprecedented times?
Absolutely. See, that's what I was talking about. Having the courage to accept that there is a problem, uh, and then doing something about it. That's really where the courage comes in. Getting help, whether it's about eating. Now, eating is a big problem, right? Eating disorder has become a problem. People are taking to food to deal with as a coping mechanism to deal with the stress. And that can easily get out of control. Many of you may have experienced it. I did. I gained 20 pounds in 3 months. I was shocked. I'm like, what am I doing? Every day, my only enjoyment when I couldn't play ping pong, my only enjoyment was, what am I going to eat today? And just kind of almost binging, trying to feel better, emotional eating, comfort eating, right? And then I realized, middle of July, a month ago, I realized, like, no, we got to control that. So, slowly started to have. So I needed some coaching. I actually spoke with a nutritionist. She helped me make a plan that you can live with, that's sustainable, right? You have to be logical about it, not a extraordinary plan that I want to lose 20 pounds before a wedding kind of a plan. You need a plan you can live with forever because you want to adopt healthy um, lifestyle forever. So it has to be sustainable. It has to be something you can live happily with. Of course, you need coaching for that. Because it's one thing to say, eat healthy, eat less, control your portion, eat more vegetables. But it's another, it takes a little bit of more digging into it and going into the details. What exactly do you like to eat? And can you live with this? You have to ask that question. Can you live with this in the long run? So you need coaching for that, I think. Yeah. Sorry, long answer.
A long question, but it's very relevant, so I will read it out. I come from a country where quarantine measures have been lifted. However, many, including myself, remained at home, whereas many others started going out and partying. However, what I have noticed is the ones who were paranoid and unhappy got sick, whereas those who went out without PPE did not get sick. Do you think that there is a cognitive or emotional state which makes COVID infection more likely?
Yeah, the fear, right? Fear, anxiety. Absolutely, I agree with that. Yeah.
Yeah,
Isn't it
I
a
think
movie?
it's difficult.
There is a movie. My sister has a favorite movie called The Secret, in which I think it is about that movie. It has similar message. The way you're thinking about things uh, can really impact on what's going to happen in real life for you. Yeah.
Absolutely. And we have one question that says this pandemic has affected educators a lot. They have to work under pressure as teaching transfers to online mode. Could you please advise on self-care beyond COVID-19? This is interesting. What would
Yeah.
you say?
Self-care beyond COVID-19.
What does
Yeah.
self-care look like for you? I think our viewers would also like to know what that means to you.
Self-care. Well, I think, of course, eating healthy, getting your exercise, but I think the biggest thing is spending time with your family and laughing. To me, there's something really very precious about that, having that time. And again, you have to be creative. Not everybody is fortunate enough to have a family, right? There are people who don't have a family. And then, of course, your friends become your family, right? So being flexible, being creative in your thinking, things you can do with technology. Um, so yeah, this is new, that's the new norm, right? Technology, using technology and being creative, thinking of ideas, how you can stay socially connected, focus on healthy hobbies, things that make you happy. Laughter really is a medicine. It really is.
That's a great point. You touched upon being creative with technology. One of our viewers has asked, is long distance counseling as effective in scenarios where you're unable to physically attend a session or an appointment?
Yes. I'll, I'll share a personal story with you. Um, this is what's happening in real life today. We are doing therapy, we are doing treatment on video visits. I've not seen a single patient of mine in person in the last 3 or 4 months. And we get feedback from patients. They score us. How did we do as providers taking care of them? And the last 3 or 4 months, when I'm doing video sessions and telephone sessions, for the first time, I got 100%. So what does that say? So in short, it really works. But I think there are arguments I understand. When you're not when you're not face to face in person with the person, it's not the same. But what else can you do, right? But I think it does work to a great extent. At least in psychiatry, in mental health, you're able to look at each other. You're able to look at the expressions, the emotions. It does work. I think it is doable. It's not impossible. Let's say that.
Great, thank you. That's very encouraging. We are getting a few questions about children, so I will read out a few. Studies in the U.S. show that children were affected during this pandemic due to poor relationships with the parents at home. As per the study, it would have a long-run effect on the children's psyche, and this requires a lot of training that the government should give to enable the teachers to mitigate the bad effects that have impacted the psyche of children. Could you share your
Sure.
thoughts on that?
I mean, yeah. I mean, teachers are therapists, aren't they? Especially they are like child therapists. They are the best child therapists for the kids, or they are sometimes the only child therapists for them. Absolutely. I mean, wouldn't that change the whole world if teachers were equipped with some formal training in that area? I mean, how helpful would that be? They would be able to identify problems. They'd be able to help with some of the problems, and isn't there, that old saying, the hands that rock the cradle are the hands that rule the world? I know that applies to the mom who's raising the child, but aren't teachers a big part of that? Aren't they raising children in many ways? So yeah, absolutely. I fully agree with that.
Great. And we have a question which I believe would apply to both adults and to children. So during this difficult time, what can we do to make it easier and to avoid long-lasting impact? So maybe it's some things we can do right now to avoid psychological damage in a year or two from now. Not having the fear of going out and hugging people or meeting your friends. Is there anything we can do at this time?
Yeah, that's a great question. How things have changed now and what consequences can happen and what we can do to prevent it. That's a great question. I'll be honest, I haven't thought about it.
I think we're all in a new situation, isn't that right? We have to learn as we go along, and we have to try different things
It
during this.
helps to, I do agree that it really helps to take care of yourself, right? Even if you want to help your family, your wife, your child, your children, your friends, your relatives. But I think it always starts with you. You have to take care of you. You really got to put your own oxygen mask first before you're going to help anybody else. That's
Yes.
really, it really applies here, especially when it comes to mental health. I agree.
And there's a quote I love, which I feel fits in very nicely with your answer. You can't pour from an empty cup. So you have to fill up your cup, and then you're able to share others and spread that positivity and strength with them.
Thank you, Zarmina. I really like that. You can't pour from an empty cup. That's so true. So true.
Wonderful. And we have a few more questions. A lot of the times, adults don't want to discuss things with children in order not to burden them while taking all the stress upon themselves. I think this is a very common situation we see. And what is your advice on this situation?
I, you know, I totally agree with that. I think parents become very protective of their children. I see that in my clinical practice all the time. Somebody who's suffering so much that they are really thinking about, I don't want to live anymore. But they don't want to share it with their children. I don't want to burden my child with something so painful about me. But I think children want to know. And that barrier that we have created ourselves, that I don't want to burden my family, we have to change that. Family likes to know, family likes to be involved. There are lots of family studies done. Here, I want to share something with you about that. Studies on schizophrenia in Scandinavian countries compared to Nepal and India. The relapse rate of schizophrenia was a lot more in those very wealthy countries as compared to, again, the poor countries, third world countries, because of the families, the strength in their family system in the third world countries. Families are together, they are there, and it helped with the relapse rate of schizophrenia. So in short, I think family is significant. Family also, by the way, when we talked about denial, family also can be, I use family as a tool to help with the denial of the patient. Because if the patient who's in denial, they're never going to tell me the facts, right? So we need collateral information from the family. So involvement of family, involvement of children is crucial, I think, when you're trying to learn and do something about mental health.
It's great, thank you. And we have a question here, which is a thinker. It's a good one. Is it healthier to accept that the life in the pandemic is the new permanent state of existence? Or is it better to live in hopeful thinking that life will go back to normal?
That's a great question.
What would you say to this, Dr. Shuja?
I would hope that it would go back to normal, but I'm sure, you'd be wise to think that, be prepared. Things will never be the same again. Not completely the way they are right now, but there will always be some. I'm sure, for example, I'll give you again our example of how we function. We used to see people in person all the time in psychiatry practice, right? Once they said it all shut down, we started doing telehealth or telepsychiatry, either telephone or video visits. Now, after a year or so, once things hopefully, the pandemic is gone, we have a good, successful vaccine. When things go back to normal, I wonder how our patient population would say, you know what, doctor, why do I have to come to the clinic when we can so easily do the video? I don't want to drive. I'm going to use another hour of my day to go park the car and then see you in person. Why can't we do it over the video or telephone? So I think the impact of what is happening now and how we have to adapt ourselves, there will be some impact later on. I'm pretty sure of that.
And for our medical professionals watching the session today who've probably experienced a similar experience as you in terms of teleconsultations, how has that been for you in terms of providing care virtually? Have you felt the same connection with your patients? How has that experience been for you as a medical professional?
Great question. So a little frustrating experience was the not being able to make the video. Okay, so we are on time constraints when we are doing sessions with patients, right? We only have a half an hour for follow-up, 1 hour for an intake of a brand new patient. You still have that much time. Technology may not be working, right? The Wi-Fi is not working. The patient is not familiar with doing the video visit. So that part gets frustrating because it eats into the limited time that you have. That part has been frustrating. But once things are working, it's very efficient. It's really smooth. I have loved it. It's great. It's very convenient too.
We actually have a brilliant question that ties in with your answer. And this is the second question from this person, which says, you answered my question about hopeful thinking. And as a follow-up question to your answer, which intrigued me a lot, do you reckon that humanity would lose the importance of face-to-face interaction and would become more adapted to a digital and remote style?
That's a great question. And I'm afraid that there will be some impact. There will be some impact, especially with the younger folks, the new generation, who haven't had the opportunity to experience both as much as some of the older folks have, who have seen the pre-pandemic life and the post-pandemic life, right? But the younger folks, this is it for them, right? So this becomes the new norm for them permanently. In some ways, I'm afraid. That's my guess. I'm no expert in this topic.
I mean, I know you're a father, Dr. Shuja. Maybe our viewers don't know that. So I think that's coming from a soft spot for you. Probably you have a very young son, and probably that's all he has seen so far. Is that right?
Yeah, that's a great point. I mean, he's 6 years old. I mean, the way he's seeing things. I mean, he's just happy. He doesn't want to leave the house. We are allowed to go to the beach. He doesn't want to leave the house. He's just happy to see his dad in the house all the time. He gets concerned if I ever have to step out. Like, where are you going? So I'm afraid that they might think this is normal. This is not normal. Yeah.
That's great. And Dr. Shuja, we're getting some questions about when is it an adjustment disorder and when is it a more serious psychiatric condition? And we were also getting a question that overlaps that wants to know a bit more about the biopsychosocial model in terms of coping mechanisms. So that was a very loaded question, but if you could touch upon those areas for us.
Right. So I think anybody can go through an adjustment. I dare say that all of us have gone through or maybe still going through an adjustment disorder to this pandemic. I did. When it happened to my mom, I was not okay mentally. When I couldn't play ping pong, I was not okay. So you have to adapt. So adjustment disorder with psychiatric symptoms, depression, anxiety, conduct issues, behavioral issues, That's temporary and short-lived. Um, when it becomes very severe and long-term, that becomes, a different kind of a psychiatric problem, like major depressive disorder versus depression due to an adjustment disorder, or anxiety, severe panic disorder, generalized anxiety disorder, long term is different from adjustment disorder causing anxiety, right? People with severe anger issues long term is different from adjustment disorder causing behavioral problems, anger problems, violence problems, things like that. Uh, but having said that, people who are very vulnerable, the adjustment disorder can cause some severe problems. You know, people who are very vulnerable, they can have severe problems. So I don't want to minimize that adjustment disorder is means that it cannot be bad. It could be very, very severe. Yeah.
Okay, and can you touch upon the biopsychosocial model as well? We're
Yeah.
having some
Yeah.
questions.
So biopsychosocial model to explain psychiatric illnesses. So almost every psychiatric illness um, can be explained by this model, which talks about the biological factors, how that affects us, the psychological factors, how that affects us, and the social factors, right? So biological factors, examples could be our genetics, right? Family history of psychiatric problems. Of course, somebody who has that family history, the genes, they're more vulnerable. Hormonal problems, thyroid hormone, and then stuff we do to our bodies, chemicals we put in our body, including alcohol and drugs, right? Those would be examples of biological factors. Things wrong with our brain, for example. Um, Psychological factors are usually from the past, like we were talking about the childhood, the impact of what happened in our childhood, psychological development, the impact of that in later on in adult life. So psychological factors and how we learn to deal with things, the cognitions we develop, the way we think about things. Uh, some people have cognitive distortions, right? Because they've learned to think that glass is always half empty, right? And then the social factors, of course, your work, your finances, your social support network. Um, it could be good or it may not be good. So a combination of all those is usually responsible for causing a psychiatric problems. In some cases, there could be a severe factor coming from one of the areas, like an extremely severe family history of some psychiatric issue. So they are more vulnerable. Or most of the time, it is actually the combination of all these factors that leads to psychiatric problems.
Thank you so much, Dr. Shuja. We will be taking our last question, and that is once again about children. And the question is how post-traumatic stress disorder, PTSD, created due to COVID, should be handled by educators, particularly for students because of long absences at school and spending more time at home. How should educators and counselors handle the situation?
Great question. It's going to be a tough one, I think. I think the first thing educators can do is be aware, have the information, what is PTSD, or be aware to recognize any signs of mental health issues in the child. Communication with the parents. When it comes to children, things are different. You have to go through parents, right? So communication with the parents and hoping to get professional help earlier than later. And parents should not be in a denial about their possible contribution, because we always know things come from home. Parents' possible contribution to the child's health issues. Parents should not be in a denial. So I wish parents were here listening to me talk about denial. So that chain, teachers recognizing an issue in children and being able to communicate with the parents in a way that they'd be willing to not dismiss that. I think parents should not dismiss what the teachers have to tell the parents, and then doing something about it, getting some help for the kids earlier than later. I hope that helped.
Thank you. That's absolutely wonderful. That was our last question of the evening. Finally, Dr. Shuja, do you have a closing message for our viewers this evening?
I do. I do. I hope that I have not given the wrong message that, oh, this is the perfect way of living and this is a bad way of living. There's no such thing like that. So my message is have compassion for yourself. Be flexible. Don't be in denial. If your family is telling you something, don't dismiss their feedback, right? That's my have compassion for yourself and also for others. Everybody's trying their best during this disasters times, right? So that's my message. And then, that lady who taught the lesson to my neurologist guru, the positive power of negative thinking, from that experience is another saying with which I would like to end my discussion, which is the secret of happiness is in our attitude. And the secret of attitude is gratitude. That's exactly what she did, didn't she? The cleaning lady. Thank you so much for listening to me.
Thank you so much, Dr. Shuja. I would like to thank everyone who submitted their questions and who logged in today on our webinar on mental health and coping during COVID-19 with Dr. Shuja Jafar-Ali. I hope you all gained some interesting insights, and always remember to prioritize your mental health. If you have any questions for Dr. Shuja or about our upcoming webinars, please email us at wellnesswednesday@thpglobal.com. Next week, same time, same place, we will be having a very exciting webinar with a special guest joining us, Ms. Zainab Salbi, a women's rights activist, writer, public speaker, and founder of Women for Women International. People magazine named her one of the 25 women changing the world. Foreign Policy magazine named her as one of the 100 leading global thinkers. And Fast Company identified her as one of the 100 most creative people in business in 2016. I look forward to seeing you next week for THP's Wellness Wednesday webinar. Thank you, everyone.